Cigna actually reached out to me earlier this year. I was curious what exactly they wanted to talk about at the Consumer Electronics Show and at the Digital Health Summit in particular. I was actually just so, I'd say excited, but really surprised that the words that came out of their mouths was really about affordability and transparency and then personalization. And so as we dove deeper, I found it highly, I thought it was something that would be really relevant for you guys to hear. So I'm very honored to welcome our next two speakers to the stage. Why don't you guys come up and I'll introduce you, Casey Ross, who's going to be leading this conversation from Stat News. He is the national technology correspondent, and you definitely should be checking out Stat News to follow their great articles. Thank you.
Well, thank you very much. I'm thrilled to be here. For those of you who aren't familiar with Stat News, we're really engaged in trying to disrupt digital journalism and the business model that underlies journalism, and particularly healthcare journalism, at a time when doing so is really crucial to the survival of our business. So we'd love to have you engaged, and your readership is really important to us. We have a number of free newsletters as well as a subscription site. So please check us out at statnews.com. I had to get that out of the way. My boss is in the audience. Now we can move on, okay? But I'm really excited to have this conversation with Lisa today because I think there were a number of really interesting statistics that were just in that last presentation about the lack of awareness of some of the tools that we're all here to talk about and that we're trying to get people engaged in. So Lisa, I wondered if you could start out the conversation by talking about your strategy for getting the word out about the things that Cigna is engaged in and the digital tools that it's adopting now.
Yeah, no, I appreciate that. Thank you very much. And I guess I should also qualify. My boss isn't in the audience, but I think he'd appreciate if I mentioned that Cigna is a health services company. And on behalf of our 74,000 employees, I'm honored and privileged to be here representing the organization. For those of you who don't know, Cigna provides health services, including health insurance, wellness, coaching, wellness tools, and other types of services. And our focus is on helping individuals take control of their health. And so to your question specifically, how do we do that? How do we help individuals take better control? And how do we get the message out there? I'll start with the fact that there's a need, obviously. We saw that in the data that we just saw a few minutes ago. And if you think about the state of health today, the reason why we are amplifying our voice, whether it be through paid media, earned media, through engagement, CRM programs with customers, multiple modalities for reaching individuals, it's because of the data we just saw. Health can't wait, and we see more and more individuals that are just waiting until they're sick or chronic to go in and talk to their healthcare professional. And as a result, we're seeing just some tragic numbers. If you think about, for the first time in over 20 years, we have had 2 years of declining life expectancy in this country. It's tragic, right? You have 150 million individuals in America that are dealing with at least one chronic condition, about 100 million dealing with more than one. So you think about all the things that they're dealing with, and then on top of that, let's face it, our industry is complex. It's complex, and it can be unaffordable, and we owe it to the individuals, not only in this country but around the world, to ensure that we are providing them with access and choice and affordability, and importantly, simplifying the complexity that exists in our system. And so our focus is on getting the message out on take control of your health, allow us to work with you to look at your whole health, not just going in and talking about how you're feeling physically, but how are you feeling emotionally? Because they're very, very connected, and whole person health is really where we're focused. And just to put a finer point on it, we actually take it way upstream to prevention, because the way that we can not only improve eroding health status, but the way that we can improve affordability is by helping individuals with preventive care. And so you'll find that a lot of our message, which is very PSA style type of messaging, is really about the basics. Go in, talk to your healthcare professional, get your annual checkup, get your biometric screening, and start taking control of your health.
And so Cigna's been engaged in a digital evolution of sorts for some time now, but talk about the technologies and the companies that you're now investing in, and why. Sort of give us a flavor of the span of products and ideas that you're putting into place.
Yeah, maybe let me just step back for a second, because we are making investments in other companies, but we really approach our investment in capabilities and innovation in really 3 different ways. We do it through certainly acquisition of capabilities, we do it through partnerships, and we do it through organic innovation as well. So to give you some examples, if I'm going to attach an example to each one of those, on the acquisition side, we recently acquired a company called Brighter. And this organization is giving us greater digital tools, helping us to bring greater transparency to our ecosystem, helping individuals to navigate and to find the lowest cost and best provider for them. So one that's convenient, one that is affordable, one that is highly rated, and being able to have the transparency around that, it has been absolutely phenomenal. They use a proprietary algorithm called Brighter Match that allows us to match the individual with the provider. So that's an example. On the partnership side, many examples. I'll feature one, which is Omada Health. And Omada Health, which is a digital therapeutics company, has done just great wonders in helping us connect individuals not only who have diabetes today, but who are at risk, who we predict through our predictive models and our insights are predicting to be at risk, and how do we help them take better control of their health today so that they don't get type 2 diabetes, so that addressing potential hypertension issues, and then those who do have diabetes, engaging with them both digitally and face-to-face and through coaching in multiple ways to help them manage their chronic condition. So that's, they've been an absolutely wonderful partner, and most of our employer partners are making that program available to their employees. And then I would say on the organic innovation, a lot of work happening here as well. And probably my favorite example of that is OneGuide, and it's an absolutely wonderful capability. It's a combination solution service, but it brings machine learning and predictive analytics and marries it with the human touch. So we use these highly personalized tools to be able to help individuals understand what's the next action I should be taking? What are the questions I should be asking? What are the things I should be thinking about today in a very contextually relevant way, which is so incredibly important? And then where needed, we connect them with 2,600 different coaches, clinicians, nurses, and individuals who can help them again, take better control of their health. So those are just 3 examples, and maybe I'll just mention one thing, because I think it's so critically important, based on the conversation that was taking place on stage here a few minutes ago. Mental health and the issues around mental health are just so prevalent today, and we're partnering with a couple of organizations. Happify is an example, and Prevail Health is another example, who are bringing mental wellness and overall wellness tools and capabilities and services to individuals, and really making a difference in that space. So those are some examples.
Well, there's such an explosion of technologies that are coming available now, different products and pitches coming at us from all angles at all times. My overloaded inbox is testament to that. And I'm curious about your process for vetting these, and for separating waste from value at the stage we're in.
Yeah, so we have a part of our organization called Cigna Ventures, and it's an opportunity for us to make investments in companies that have capabilities that are aligned to our strategy. And so we look at organizations that are, for example, in the insights and analytics space, to be able to amplify the work that we're doing there. We look at digital-oriented and retail companies. We look at care services and care management companies. So we think about it from that standpoint, but the decisions that we make there, back to your point, are really around where's the fit and the alignment around does it strategically make sense for our business, and does it financially make sense for our business? And the only other thing I'd add is that we're a learning organization, and so many of the investments that we make, assuming that they fit the framework that I just laid out, we are able to dig in and really understand what are they working on, why are they working on, what are the opportunities for us to either acquire, partner, co-develop additional capabilities in this particular space. So it's been really exciting for us. As you would imagine, similar to your inbox, our inboxes are like that as well. But it's exciting for us to be able to vet so many of them so that we don't miss that future potential opportunity that is going to continue to help us transform the healthcare space.
And so, with a venture fund through which you're investing in companies that are also contracting with you, how do you manage that relationship and ensure that the investments that you're making are not creating conflicts in ensuring that the products that you are investing in are really servicing customers in a way that benefits them and not just Cigna?
Yeah, so a lot of it is through test and learn. So we spend a lot of time, some of them are pure financial investment plays. Some of them are truly learning opportunities. So from our standpoint, it's really about how do we pilot some of these technologies, and we're constantly piloting capabilities to be able to say, is this something that has potential and can we scale it? And so we have multiple examples of where we've done that. In fact, the examples that I gave earlier, Brighter's an example where we piloted their capabilities for a period of time, and then we implemented it for a portion of our business, and then ultimately we said, yeah, this is a capability that we want to own, it's differentiated, and it differentiates us, and so we acquired the company. So it's really about starting out with a lot of just piloting and testing and learning early on to be able to say, does this make sense for us?
And why now? Why this moment for this concerted investment in digital health and technology? What about this moment is different from 3-5 years ago?
Well, I think just the state of health, especially in this country, tells us health can't wait. We have to invest today in the digital capabilities, and we believe as a company in wrapping those digital and technology capabilities with the human element as well, because at the end of the day, humanity plays a very important role in an individual's health, and so that becomes important for us. So the why is because our focus is on improving health. Our focus is on engagement, because we know that if we can use technology to simplify the experiences, that helps us engage the customer. We know that engagement helps with medical adherence, treatment adherence, which then ultimately results in better outcomes for the individual, which then results in lower costs for the individual, for the employer, for everybody in the ecosystem. And so from our standpoint, that reaction has to start upstream. We have to start with simplicity. We have to start with prevention, because only that, in my opinion, that's the way in which we will drive lower costs for the individual, is by starting with, if you're healthy, let's keep you healthy. And if you're at risk of being unhealthy, let's address it right now. And if you're chronic, we're going to be there by your side and nudging you and encouraging you and helping you to manage those conditions as well. So why now? Because health can't wait.
And Cigna was a forerunner, really, in efforts to build a cost transparency tool. And I wondered if you could address sort of the status of that effort and the challenges that you faced along the way, given our system where it's not so easy always to sort of determine costs and really understand what they are before you get care and know what your costs are going to be.
No, it's a great question. I think, again, I'll start upstream by saying that when we focus on prevention, that certainly helps price downstream. When we focus upstream on our ability to drive greater value-based care through partnerships with physician partners, that helps with overall pricing downstream. when we're able to work with pharmaceutical manufacturers to price drugs and price our contracts based on outcomes versus just on use, that helps affordability downstream. Downstream then for the individual, we have our price and medication tool that we continue to evolve and iterate upon, and I love it because it's so easy to use. Our customers can go in, it prompts them with their list of medications, it gives them options not only for types of medication, but it tells them based on your specific history, based on your specific plan, here's what it's going to cost. And here's what it's going to cost if you go there, here's what it's going to cost if you go there, here's what it's going to cost if you go through home delivery. And so serving up options to the individual that are convenient for them, that are the lowest cost for them, is really what that is about. And so we pride ourselves in giving as much transparency as possible so that they don't have surprises downstream when they show up at the pharmacy and realize that, oh gee, that price was, that drug wasn't covered, or gee, I had a different option. Because we know what happens, right? You get to the pharmacy, and if an individual can't afford the medication that they've been prescribed, very often they'll walk away. And they'll say, well, gee, I can't afford that today, so maybe I'll just wait until I can. That's just not good. That's just not good. And so our goal is to increase the usage of the tool to ensure that everybody is aware up front of what's covered and how best to manage their health.
And on that topic, on medicines and costs, I've saved the best for last. Piece of news this week is that Cigna closed its acquisition of a little company out of St. Louis called Express Scripts. So that you may have heard of that, and so that's obviously a big deal and a big change coming. And I wondered if you could talk about some of the changes that that may flow out of that in terms of the pharmaceutical supply chain and transparency in the way that might work in a combined organization.
Yeah, no, thank you for that. We're very excited about it. So we closed our deal a few weeks ago, and very exciting to come together with this wonderful organization. And I think what I would start by saying is that partnering with them and combining with them has given us the opportunity to accelerate and just really supercharge our strategy and the things that we've been talking about here today. It allows us to accelerate that even further. I'm very excited because both companies came into this combination with a lot of momentum in terms of growing customer base, in terms of connecting and reaching with individuals and innovating. And you've got two great innovative companies coming together, bringing their resources and capabilities and their talent together, which has been just phenomenal. And so I'm very, very excited as we've been digging in recently now on the integration of the two companies. It's been just wonderful working with the organizations to say, how do we accelerate it? What are the opportunities we have? One example is we have, I'll give you a little bit of a sneak peek of something coming at the end of the month, which is through our Express Scripts business, a new solution that is going to take a variety of solutions and systems and fully integrate them in a way that allows the individual, the employer, the provider of those services to be able to look at the full picture in a way that's never been done before. And it's something that physicians and pharmacists have been asking for a long time. And I'm excited about the fact that we'll now be able to bring it to market at the end of this month. So we'll be hearing more about Health Connect 360 in the coming weeks.
And there is a lot of data obviously involved in this transaction that both institutions, both companies really bring to bear. And I wondered if you could talk a little bit about maybe broad strokes, your strategy there, what other kinds of tools might flow out of this relationship, out of the combined company.
Yeah, so a couple of things. One is that combined, we have 160 million customer relationships. So you think about the reach and the opportunity we have to touch that many lives. It's a privilege to be able to do that, and we take it very seriously. We have together over 1 billion touch points and interactions with individuals. So again, an opportunity to reach individuals and connect with them in a very meaningful way. And so I'm excited about that. I I'm excited also about the fact that from a capability standpoint, being able to bring the power of two analytics-oriented companies and two customer-obsessed companies to bring better solutions to simplify experiences for customers. Very, very excited about that. So lots of work happening in the progress. As I mentioned, we have Health Connect 360 coming at the end of the month, and I think you're going to just see a series of new innovations coming, all designed whole person health, and how do we address through predictive analytics, machine learning, and technology, how do we address the health of the individuals and better health for individuals. And that's what we're about, and that's what I get jazzed about.
Well, we'll have to wrap it up there. We're out of time, but thank you so much. It's been a great discussion. Really appreciate it.
Appreciate it. Thank you.
Thank you.